Hey guys, Adam Gill here. Today I want to give you some information on Medicare Advantage. When it comes to Medicare, you really have two options. You have Medicare supplement plans, you have Medicare Advantage plans. And today I just want to give you some basic information on how Medicare Advantage plans work and what to look for when shopping for different options. Okay, so first things first, kind of an overview on Medicare. When you get Medicare, you're going to have your Part A and your Part B. Your Part A pretty much covers your hospitalization services, anything in the hospital. Part B, everything away from that, your doctor visits and your outpatient services. Okay. Part B, as of this video, is $148.50 a month. If you're collecting Social Security, they typically will draw that directly out of your Social Security check each month. If not, they'll bill you quarterly if you're not collecting Social Security yet. If you're having higher income, that 148 can be a little bit more, just depending on your income, but typically it's 148.50 a month. Okay, so the Part A and the Part B is going to cover 80% of all of your medical, your hospitalization, doctor visits. So they're paying 80%, you pay the other 20%. Okay, and then that's when the Medicare supplement or the Medicare Advantage plan comes into play. Again, I got another video on the Medicare supplement. Today we're going to focus on Medicare Advantage. So the Medicare Advantage, what you hear is Part C sometimes. It's offered by private insurance companies. You still have your Part A and your Part B. It's just when you go to the doctor, you're not using this card right here. You're using the card of the insurance company, okay, whatever company you're with. It covers all Medicare approved services. It combines your Part A and your Part B services all in one plan, okay? So you don't lose anything by having it. You have to have the Part A and the Part B to have a Medicare Advantage plan. It also, some plans can offer other things beyond original Medicare. It can offer dental, vision, hearing, over-the-counter benefits. So different plans offer different things. You just want to look at the benefits, which we'll show you in a second on what to look for on different plans. Part D is your prescription drug coverage. Now, if you just have original Medicare, you have to have a Part D drug plan, but most Medicare Advantage plans are going to have a drug plan included with it. So you don't have to have a separate drug plan. You're going to have that included with your Medicare Advantage plan. Okay? So Medicare Advantage plan types, the way they work, you have HMOs and you have PPO plans. All right? Your HMO plans are going to give you lower copays with the doctor. They give you a smaller network of doctors to choose from typically. You do need a referral as well to see specialists. Now, the benefits of an HMO plan are the fact it's going to have very low out-of-pocket cost. So if you don't go to the doctor very often and you're very healthy and you just want to have the lower copays, an HMO plan can work out perfectly fine for you because you're going to get the most benefits possible at the lowest out-of-pocket exposure you can have. You really, really are. So a PPO plan is going to have a little bit higher copays, but it gives you a much better network of doctors to choose from. There's no referral needed for a specialist. Also can give you some out-of-network options as well. So if you go to a lot of different doctors, you're seeing a lot of different specialists, you may want to consider a PPO plan because it gives you a lot more flexibility and freedom to kind of do what you want to do versus the HMO plan where they have a little bit more control, but it does cut cost and save you money. So it just depends on kind of your preference and your situation on what you're really looking for. But just make sure you understand the difference between HMO and PPO when you're looking at Medicare Advantage plans because there are some differences there. You also have special needs plans. So if you're someone that has Medicaid, there are actually plans that work very, very well with Medicaid and can really lower the cost of your co-pays tremendously down to nothing in most cases if you have Medicaid. So make sure your agent knows if you do have Medicaid. There's also certain health conditions that you can have where there's certain plans that can help you out with those as well. Now, Medicare Advantage plans are different in every county, in every state. Now, I have sometimes someone will call me, hey, Madam, my friend has this plan over here. Well, they're in different counties. So every county is different when it comes to Medicare Advantage plans. So make sure you're searching all the plans in your specific county that you live in. Okay. Now, most Medicare Advantage plans also have no monthly payment. So you pay your Part B premium of $148, and that's it. Okay. There are some plans in some states, different counties will have a small monthly payment, but most Medicare Advantage plans have no monthly payment at all. Okay. The only thing you're going to pay is when you use it. So your co-pays with the doctors and hospitals and things like that. Okay. Now I'm not going to get any benefits today on specific plans. I'm just going to give you an overview how they work. Some important things that you want to really know when it comes to Medicare Advantage plans. The plans are annual contracts, so the benefits can change each year. So if you have benefits this year, what will happen during the open enrollment period, which I'm going to go over those dates in a second, you really want to look at your annual notice of change because your benefits could be different the following year. So make sure you're aware of your benefits each year, because you might be surprised you go to the doctor next time your co-pays are more, your doctor may not be in the network. So just make sure you're aware of any kind of changes. The company will send you those changes every year toward the end of the year, which we'll go to those dates in a second. Make sure when you're going over a plan, your agent's reviewing the summary of benefits. Review them in detail. The summary of benefits is what's going to tell you your co-pays for everything. It's going to give you the co-pays to the doctors, the hospital, your surgeries. It's also going to tell you what preventative care services are covered. Is there dental vision included? Make sure my medications are covered. So make sure you go over the summary of benefits in detail because that's going to give you a really good breakdown of exactly how that particular plan works. Also, too, like I just mentioned as well, the formulary, which is your prescription list. Make sure your agent's looking up every one of your medications. Make sure your medications are covered on these plans. So one of the most important factors on these plans is you could be with company A and your medicine's $40 and company B it could be $15, okay? So make sure your agent's shopping around the different options for medications and making sure your medications are covered on the particular plan you're looking for, or you're looking at. And also, too, extremely important, make sure your doctors are in network. I can't tell you how many times I'll get a call from someone and they'll tell me, hey, Adam, I've got this plan, but my doctor's not in the network. I had to switch doctors. So if you have a doctor that you want to make sure that you can see, make sure the agent or make sure you're looking at that plan and look up the doctors on the specific plan and make sure your doctor's in the network, okay? Also, too, when you're looking at plans, Medicare give these plans star ratings, 1 out of 5. So you can have a company that's a 3-star company or a 5-star company. Is rated on quality, service, and performance. So just make sure you're looking at a quality company that has a good rating. Okay. When can you enroll? The way Medicare works, when you're new to Medicare, when you turn 65 years old, that's your initial election period. 3 months before your birthday, the month of, and 3 months after your 65th birthday, you can enroll into a Medicare Advantage plan, okay? If you're under 65, if you have a disability, and what this is saying, if you've been collecting disability for 24 months, you then may qualify for Medicare, and you can actually enroll into a Medicare Advantage plan as well, even if you're under 65, okay? So something very important to know. Avoid a late enrollment penalty. What that means is if you're turning 65 and you don't have a Part D drug plan, you can actually get a penalty for that. Also, too, if you don't enroll in Part B and you don't have other credible coverage, you can also get a penalty for that. So make sure you're enrolling and make sure you're covered with a drug plan in Part B if you don't have other coverage going through like an employer or other resources, okay? The annual enrollment period. So if you sign up for a Medicare Advantage plan today and what happens and you're not happy with that plan, you can change your plan every year. Between October 15th and December 7th is the annual election period. So you're not stuck on that plan forever. So just make sure during that time period you're reviewing the benefits on your plan. Make sure there's no drastic changes on your plan. If you're happy, you can keep it, and as long as things are staying the same, and just keep on going just like you were the year before. But if you're not happy, or if there are certain things that have changed on your plan, this is when you can shop it around. If your health has changed, your medications have changed, you want to double check the plan and make sure there's nothing better for you, okay? You have special enrollment periods. If you ever lose coverage, like from an employer, if you have a household move, or if your Medicaid level changes, there's some certain ways you can change your plan throughout the year if you have a special election period. You always check with your agent. That's the benefit of having an agent, is they can help let you know what's available to you during those time frames, okay? And then after you sign up for a plan, you have something called open enrollment period. That begins January 1st and ends March 31st. So if you're enrolled in a plan during the annual election period and you're not happy with that plan, or if it might have been a bad selection for you, you can get out of it the first 3 months of the year. Okay, so you have some option to get out of that plan if you're not happy with what you chose. Okay, so hopefully that gives you a good understanding, just kind of an overview on how Medicare Advantage plans work. Again, I didn't get any detail on how the benefits and things like that, because benefits with every company are a little bit different. So just make sure you're reviewing the summary of benefits and your understanding is HMO versus PPO. Make sure your doctors are in the network, and make sure your medications are covered. Okay? If you have any kind of questions, or if you want to see some specific plans in your county, let me know. I'd be more than happy to help. Thanks. Have a great day.